In 2021, the Aga Khan University, specifically the Institute for Human Development in partnership with the School of Nursing and Midwifery, SONAM, carried out a study on psychosocial well-being and resilience among frontline health workers.
We conducted this study at the height of COVID-19, and among 47 counties, we were looking at nurses, midwives, and community health workers. Among the 1,907 nurses and midwives, about 1 in every 4 reported depression, and then we had about 2 in every 5 who reported PTSD.
Many times people focus on nurses, midwives, doctors, but we know that in Kenya, the community health volunteers form a very important community-based cadre of health workers. And we really wanted to understand what are the challenges they face in terms of their mental health, what are the coping strategies, and what are the support systems there.
As Aga Khan, we implemented several measures to support the health workers. We worked with the National Nursing Association of Kenya. They had a call center where nurses could call in and when they were in distress and get psychosocial support. We also implemented a messaging system where we sent messages to health workers, both nurses and community health volunteers. Alongside this, we had a counselor whom the health workers could contact if they were in distress.
The messages used to come every week. I would receive a message on how to be about nutrition, about rest, about how to deal with the difficult situations.
Those messages are very, very relevant because they touch on the life of the nurse and remind them about themselves.
The messages were very useful since they were addressing the issues that the community health volunteers were going through. As the messages come to them, it means that they don't have to go very far to look for help. And yet during the study, we were able to know that they were going through a lot of mental health issues.
Mimi nilikuwa mtu wa hasira by the way, na ningejipata hata saa zingine nimekosa kusikiza mtu juu ya vile tunajibishana, so inakuwa hatutaelewano juu tempa yangu ilikuanga juu. Lakini kutokana na hii programu yenu, kwa saa hii naweza mpeleka pole pole mpaka tupatane.
In my own view, I think this study was long overdue.
It was an eye-opener because you need to be okay mentally to be able to take care of others.
During the baseline survey, we identified counties where health workers were really missing the key resources that they needed to provide the services. So because this study was done at the height of the pandemic, the key resources that they needed were the personal protective equipment. So through funding from Johnson & Johnson Foundation, we were able to purchase these PPEs and distribute them. I've gained skills in study coordination, and in particular, I've been able to coordinate implementation of this study in all the 47 counties in Kenya.
I was able to learn skills in conducting telephonic interviews. Secondly, I was able to learn or build skills in conducting psychological first aid. I learned skills in how to coordinate a virtual intervention in terms of timing, in terms of respondents, and being there to guide the participants.
We are thankful to all the stakeholders who took part in ensuring this study was a success, including the Nursing Council of Kenya, the National Nursing Association of Kenya, the community health focal persons, the ministries of health in different counties, and to Johnson & Johnson Foundation for providing the funding for this study.